Hi, everybody. My name is Dawn Neumann, and today I want to tell you about an intervention that we created to treat facial affect recognition deficits after traumatic brain injury that has been deemed a practice standard. I do want to acknowledge that this research has been funded by a variety of federal funding and other agencies, which we are greatly appreciative of. The objectives for this session are to increase awareness of the prevalence and significance of facial affect recognition deficits after traumatic brain injury, to demonstrate components of a freely available evidence-based intervention, and increase clinician implementation and confidence with this evidence-based practice intervention for treating affect recognition deficits in people with brain injury. So why are we even talking about affect recognition deficits? So when it comes to recognizing emotions, we must be able to do this through being able to interpret this information through nonverbal cues. So for the most part, when people are communicating or conveying how they're feeling to other people, for the most part, people don't explicitly communicate this information. They do it through facial expressions, tone of voice, body posture, gestures. So it makes it really important that others are able to interpret these nonverbal cues accurately. After traumatic brain injury, this becomes a problem very frequently, and some research that we've actually been involved in, a fairly large meta-analysis, and found that 39% of people with traumatic brain injury actually have facial affect recognition deficits. And this is problematic because we also know from research that these facial affect recognition deficits are associated with worse outcomes, particularly when it comes to interpersonal behaviors and social outcomes. And more problematic is, despite the prevalence and the impact of these deficits, it is something that is very rarely assessed or treated for. There was one publication that was conducted, a research study that was conducted with clinicians. They did a survey and found that most clinicians estimated that more than 50% of persons with traumatic brain injury who have these deficits, and by deficits meaning social cognition deficits, which facial affect recognition is a social cognition deficit, go untreated. So we had created an intervention, this facial affect recognition intervention, and we evaluated it with a randomized controlled trial in people with traumatic brain injury. And this was a multi-site trial. It was also an international trial that was primarily conducted in North Carolina, in Ontario, in Canada, and then also in New Zealand. And in this study, we recruited and enrolled 71 participants with traumatic brain injury to the study. And in this study, we actually had 3 interventions. 2 of them were actual interventions, so our facial affect recognition intervention. And then we also had another intervention where we were using social stories to treat emotion recognition deficits of being able to infer emotions from narrative. And then we had a control intervention, and that control intervention was really an intervention that trained cognitive skills, so attention, memory, executive functioning, speed of processing, things of that nature. So in this, what we wound up doing is we were interested in comparing these 2 interventions, the facial affect recognition intervention and the social stories intervention, compared to the cognitive control group. We were mostly interested in our facial affect recognition intervention, and that's what I present here, the outcomes comparing the faces intervention compared to the control group. And this is looking at outcomes on our primary outcome measure, which was an assessment for facial affect recognition, the diagnostic assessment of nonverbal accuracy. So what this is actually showing is that we're looking at participants compared to baseline. And you see at baseline, both of the groups, the faces and the control group, are very similar in their performance at baseline. And then we looked at their outcomes immediately after the intervention, 3 months, and then a 6-month follow-up. And we did these comparisons were holding baseline as a covariate, their performance at baseline as a covariate. And what you're seeing is that at each one of these outcomes, there's a significant difference between the group that got the FACES intervention and the control intervention. So those people who got the FACES intervention were performing significantly better on this outcome measure. And the really cool thing is that these effects lasted up to 6 months after the intervention ended. And what I should say is that that these participants in this study were on average over 10 years post brain injury. So in the very chronic stages of brain injury as well. So, and the number of sessions typically was around 9 sessions per subject. So really kind of cool to see that this long lasting effect with such a brief intervention and in people who many, many years post brain injury. So this study was evaluated as part of a systematic review that was conducted by the Cognitive Rehabilitation Task Force and was deemed a practice standard. So they, in reviewing the literature, they found a one class 1, which was ours, and a 1 class 3 study that suggests specific intervention to improve the recognition of emotions from facial expressions may be effectively incorporated as a component of this practice standard for treating functional communication deficits after traumatic brain injury. So with that said, I do want to take some time to describe to you, show you what the intervention itself looks like and tell you more about it. So that hopefully, if you are a treating clinician here, that you will have interest in being able to use this with your patients. So with this FACES intervention, it was designed so that there are exercises that are available. They are now available through an app that is freely accessible to everybody. And through this app, there are these structured exercises, and it was created so that it could be delivered one-on-one between the patient and the clinician. And within this app, there are 7 levels of exercises, and it just depends on how quickly you can get through each level. Some levels take more or less time, and it really depends on the patient as well. So it could take 60 to 90 minutes. So the number of sessions it could take to get through all of these exercises may vary from patient to patient. Okay, so we incorporated techniques in this intervention that have already been evidence-based. So throughout this intervention, we use common things that have been already demonstrated to be effective with people with brain injuries, such as repetition. We also, the intervention starts off with activities or exercises that are more easy, that are easier, and then they progressively get more difficult, in that we are showing facial expressions that start off being more obvious, and then they gradually get more and more subtle, so that it increases the difficulty level. We also use something called vanishing cues. So it's kind of like kind of envision it as these crutches, so that it's kind of pointing to things that are more obvious to make the task easier. And then as we progress throughout the program, those kind of crutches disappear, they vanish. We also personalize we have opportunities to personalize the content for the participants as well, asking them to take what they're learning, the skill, and apply it to themselves. And then we are also addressing multiple components that we know go into how we recognize facial expressions. And that is through, so basically we are targeting things that we know are necessary for accurate affect recognition. So when it comes to affect recognition, we know that and specifically for faces, that it's important that we have accurate perceptions. So we are processing, visually processing those visual cues and paying attention to those important visual cues, such as those facial features like eyebrows and eyes and mouth. We also are targeting what's called replication and experience. So we know that when somebody has to recognize somebody else's emotion, that we are using our own personal experiences with that emotion, so that we are mimicking, we can replicate that emotion, and then we know what that emotion feels like. So we've had that experience. And once we've had that, we are better able to recognize it in other people. And then thirdly, we have kind of this higher order conceptualization, essentially this associative knowledge, in that we're taking all of this information and we're kind of tying it in together so that you have this higher order understanding of an emotion. Okay, so when you actually get into the Faces app, you're going to see that, as I mentioned before, that there are 7 levels of exercises. So you'd put in a patient, de-identified patient number into the system, and you'll see that there's the 7 levels, and you can choose level 1. And then once you choose level 1, you will see that there are numerous exercises within this level, and that you can choose. So you would start with emotion recognition part 1. And then if you select that, you'll see that for this first part, for this emotion recognition exercise, the instructions are that you'll be shown faces expressing different emotions, and the task is to identify the emotion that each face is portraying. So this is what that would look like. So how does this person feel? And the vanishing cues that I was telling you about, that is the yellow arrows that you're seeing there, as well as a hint that says to look at their eyes and mouth. And you'll see that they have 4 options to select from. If they get the answer wrong, they will be then given feedback as to what they should be noticing about the facial features. So if they chose the wrong answer, they would get this pop-up message that says, well, the eyebrows are raised here, the eyes are wide open, the jaw is dropped, the mouth is slack overall, there's no tension in the face, and the face appears open, and then it will give the actual emotion that the person is feeling, so that you're not continually having the patient guess and possibly continue to get it wrong. You will notice that the cues that are given here, so it's drawing attention to specific facial features, but also trying to get the participant to, the patient to think about the face more holistically. So it's seeing everything, it's pulling together all of the features. Okay, so then if you move on to emotion recognition, the part 2 of this level, the exercise is they'll be told that first they're going to identify the emotion for each face, but then after that, you're going to be asked to discuss a time when you remember feeling that emotion yourself. If there were other people at the event, you will also be asked to consider how they were feeling. And so again, you will be shown the face and asked how the person feels. This time those yellow arrows are gone. So again, the vanishing cues, they will be select the emotional response. And if they were correct, they would then move on. And now they are being asked to think about a time in their life when they also felt happy. And if there was another person in the event, how do you think they felt as well? So that is targeting that emotion replication experience. It's kind of trying to get them to think about that situation and what it felt like. Okay, and then part 3 is, again, they're going to be asked to identify the emotion for the face, but this time after they identify the emotion, they're going to be asked to imitate that facial expression. So they're shown the face. This time all of the hints are gone. They have to identify the emotion, and then after they identify the emotion, they are then going to be asked to imitate it. And what happens with the app is it's going to pull up a camera so that you can actually see yourself trying, the patient can see themselves trying to imitate that expression, so that their face and the face of the stimulus in the app are side by side, so they could see how close they are to one another. And as you can see, we have a patient there is one of my favorite little stuffed animals that I have. So he was eager to jump in and be my volunteer for this demonstration. Okay, so then we have another activity where we are having participants or patients try to understand the similarity across faces. So we don't want them to just learn what does angry look like on one person. We want them to see what angry looks like on multiple people and how those angry looks similar across different faces, and what are those commonalities by looking at these similarities. So in this exercise, they're going to be shown multiple faces. Here we have 2, sometimes there's 3. They're going to be, then they're asked, if these people are angry, what features of the eyebrows do these faces have in common? Are they relaxed? Are they wide apart? Are they scrunched together? And so even though these 2 faces don't look exactly alike. They're totally different. We could see that for both of the faces, the eyebrows are scrunched together. And that's a common feature for anger. And then another activity is face selection. So they're going to be shown a series of faces, and now they're going to be asked to pick out the one face that is depicting a particular emotion. So for this instance, the face that is depicting happy. So how do you access this intervention? So you can go to the App Store or Google Play. You will search Faces Intervention. It's by Obex Technology. It's pretty important because there's a lot of faces interventions out there. So you're going to be looking for this particular symbol and make sure that it's from Obex Technology. So as far as contributions to evidence-based practice goes, I'd like to think that that is pretty intuitive here. As I mentioned throughout this entire presentation, this is an evidence-based intervention to treat facial affect recognition deficits in patients with traumatic brain injury. It has been deemed a practice standard. It is something that is highly structured, yet something that you can incorporate patients' personal experiences into the intervention. And it is something that you can freely access through Google Play or the App Store. So I would like to think that if we do have patients here at RHI who have had a brain injury, who are presenting with problems and recognizing other people's emotions, this is something that you would consider incorporating into your practice. And here are the references for all of the work that we've done leading up to and including this intervention. And then lastly, I want to leave you with my email address in case you have any questions about what I went over today or questions about the intervention. And I would also like to draw your attention to 2 other Care Week presentations that are highly related to this presentation. The first is by Beth Helton, one of the speech pathologists, very talented, wonderful, amazing speech pathologist here at RHI, who incorporated this intervention into her clinical practice and specifically worked with a patient who had a stroke, who was having difficulty crying. Very interesting case study. I encourage you to check that out. And then the other one is by Raven Hill, who was part of our research team. She was very integral into expanding this facial affect recognition intervention that we created and adding an empathy component, and then also shifting it so that we were able to deliver it remotely. And we conducted a very small pilot study, a feasibility trial, just to assess the feasibility of being able to do both of these components and deliver it remotely. So also very interesting, and highly encourage you to check that out. So thank you for your time, and I hope you enjoy Care Week.